Welcome back. You're watching McLaren Port Huron's Today's Health. And in this segment, we're going to be talking about treatment for heart attacks with board-certified interventional cardiologist B. Ramesh Reddy. Dr. Reddy, what actually causes a heart attack?
Heart attack, we talked about what are the risk factors, who's more likely to get a heart attack. Diabetics, those who smoke, high blood pressure, those kind of risks are there, and with family history. The actual heart attack that happens is a blockage that develops within a coronary artery. This is a nice picture that tells you, this is a nice normal looking artery, and here you have an artery where you have a fatty plaque built up. That's not just all fat, it's a combination of some smooth muscle cells, fatty cells, inflammatory cells. So once that plaque forms, some amount of inflammation within the plaque causes it to rupture. When that ruptures, a clot comes and sits on the plaque, making this a 100% blockage, and that is a heart attack.
Okay, and then when that happens, obviously no blood can get through.
That's right. When there is a total blockage, the entire blood to the heart muscle is cut off. And unlike most other muscles that can grow back, heart muscle cannot grow back. It has a certain finite number of cells, muscle cells. If those are damaged, you can't get that muscle back. So that's why it's so precious to jump in and open it up as soon as possible.
Okay, and so I'm kind of following this through. Just like any muscle, your heart muscle needs a blood supply. And if those vessels are blocked,
then the blood supply is not forthcoming, and there will be damage to the cells and eventual death to the cells. So heart becomes weaker, and we don't want that to happen. We want to save that heart muscle. And so it's important to open up the artery as promptly as possible to reestablish the blood flow.
Okay, that makes total sense. What happens then when a patient arrives in the emergency center with symptoms of a heart attack?
Actually, the way we have here in McLaren Port Huron is once EMT actually goes and sees a patient with a chest pain, they immediately put an EKG on him and they transmit the EKG to the emergency room. So the emergency room doctor looks at the EKG and makes a determination that yes, this is indeed a heart attack. Once that happens, then the ball starts rolling. He calls the STEMI team, which includes the cardiologist, the team in the hospital called the A team. So everybody is motivated, mobilized, and they're ready and waiting for the patient. As soon as he comes, he's quickly taken to the cath lab after a brief evaluation by the ER doctor. The cardiologist is already notified, and we start the procedure whereby we look and see where is the blockage, and then we try and open it up.
What kind of time goals do you have for your whole team and for this whole process?
Typically, the national goal is to do from the time patient sets his foot in the door till the artery is open, we have 90 minutes. This is the national goal, but we are trying to do under 60 minutes, and we are close to that 60 or below in that range. For majority of the patients, we are actually under 60 minutes. So that's really the timeline we are looking at to save the heart muscle.
Which is really awesome, because that means that you're getting the best possible outcome for that patient.
Absolutely. With a patient with heart attack, time is muscle. The sooner we open up, the better it is. And here we have excellent, times in terms of how we do the intervention.
Well, let's back up just a little bit and help me understand what are the treatment options for someone that presents with a heart attack?
Well, the ones who come in with a heart attack with a blocked artery or a 90% blocked artery, we go in, take a picture of that. We go in with a wire across the blockage, use a balloon to open it up, and then we put a stent. Here is a blockage about 90-95% right there, and we're going to be advancing and passing a wire through that blockage. You will see a wire coming through. And this wire is actually going across the blockage beyond. You can see that it's getting through the blockage all the way out. Then you'll have a balloon or a stent that comes over, and now this is going to go ahead and open up the blockage, and we deploy the stent, and then the final result shows that the entire artery is open. So this is typically a pictorial way of depicting how we do it. This is an actual patient procedure that was done here at McLaren.
That's amazing, and that's called a balloon angioplasty?
That's called, it's actually a stent. That's what we used here. So we do
Okay.
a balloon and then we put a stent. So it's really, everything is pretty much combined in the same procedure.
Okay, and so then you do this all through the skin.
Pretty much through the skin with a very small puncture in the groin or sometimes in the wrist area. Those are the two areas where we go up and do the procedure.
Do most patients having a heart attack just have one vessel that's blocked, or can you do multiple vessels?
It can be done, but our top priority is to identify the culprit vessel, the vessel that caused the heart attack, open that up, re-establish the blood flow. If the patient is unstable, then we try and do the other vessels at the same time, or we stage them and bring them back before they go home or in 2 weeks to deal with them. But yes, multiple vessels can be done, but our foremost priority is to open the one that caused the trouble.
How soon do you know if you're successful?
Angiographically, meaning looking at the artery and the blockage, you will have the immediate result, just like we saw in the picture. Now, how much muscle we saved, it takes almost up to 5 to 6 weeks to get the recovery. So in 6 weeks, you'll have a clearer idea of how much recovery has happened in the heart muscle. But immediately the EKG improves, patient's chest pain is relieved, the artery is open. Those three are important signals already.
Now, as to the patient who's undergoing all this, are they asleep during this procedure?
They are sedated, but not completely asleep at all. They are given enough medication to sedate them. We ask them, how is your chest pain? Can you move your head to the right? Can you look to the left? So we have some interaction with the patient. So they are awake, but sedated, comfortable. And once the procedure is done, we should be able to hear from them how their chest feels. That's why we don't put them
Okay.
to sleep.
Okay, so then patients will have, their pain will be better.
So many patients ask me, I'm feeling so good, can I go home?
Really?
That's such a gratifying procedure for the cardiologist who's doing the procedure.
And can they go home right away, or what happens?
We keep them typically 3 days or so. And because we look for any electrical activity, how much damage has occurred, we assess all of that. Typically, if you come in with a heart attack, we're talking 3 days or maybe 3.5, 4 days before they go home.
And are patients monitored then? Because like you keep reminding me, that muscle could have been injured.
We get an assessment in terms of the blood test to see how much damage. We do an ultrasound of the heart to see how much damage has occurred. And we see how their electrical activity of the heart is during the stay. So they're closely monitored for the first 72 hours before discharge. We have them walk around and see how comfortable they are before we let them go home.
And once they're home, they're not done seeing you yet, because they're going to be back checking
Well,
in,
they
right?
should be back in a week to follow up and see what's going on, and then we follow up from there. And they should follow up with their primary care doctor also.
Wow, it's really exciting when you think about it, that you can come in with this heart muscle potentially dying, and you can do this procedure and save lives.
It is a gratifying procedure, and the more people are aware that heart attack is important, heart muscle is precious, and they should seek immediate medical attention. And most importantly, Barb, they should prevent this by quitting smoking, exercise, diet, and modifying all the risk factors. So that's really the first step. Second step, if they have symptoms, seek attention promptly. That's the best message I can give.
Absolutely. Well, we're going to take a break and then come back and talk about what's new.